Hello everyone, my name is Dan and I'm the host today. So welcome to the new episode of our Top Talks. And today we are here inviting a very famous doctor giving us a lecture about the endodontic treatment. So let's see who we have today. Doctor, could you do a brief introduction for yourself?
Thank you, Stan. Hi to everyone.
Yeah.
I am Zaher Taqi. I'm an endodontist coming from Syria. My private practice is based in Saudi Arabia, Riyadh. And we are here today to discuss and to do a course about retreatment,
Yes.
microsurgical endodontics, especially microsurgical endodontics, utilizing the Piezo and the Piezo technique.
I see. Okay. Yeah, I know. Can say you are so popular in our Facebook channel.
Yeah.
So I'm sure that there's so many fans of you. So yeah, so they are waiting.
Welcome.
Yeah.
Welcome all.
Yeah. So today, because you are talking, maybe you're giving the lecture over here today. So in your opinion right now, for the endodontic treatment daily, so what you think could be maybe the biggest challenge for you in this moment?
Actually, we have many challenges in endodontics.
Okay.
But for me, I see that the most challenged situation in general, let's say, is the anatomy.
Okay.
Is the anatomy of root canal.
Yes.
It's very difficult.
Right.
Sometimes we can do everything in endo. We can remove broken files.
Right.
We can do surgery. We can do retreatments.
Yes.
We can solve many things, but sometimes we can't solve anatomy.
Okay.
We can't see all the anatomy.
I see.
We can't clean all the anastomosis, all the areas that is very difficult to reach, clean.
Yes.
And that's why we have maybe later on some failures because of the anatomy.
Yes.
So anatomy is very difficult.
Okay.
We hope that we can reach to, let's say, a full cleaning and full shaping for all the root canal system, because at the end it's a system. It's not a root canal.
Okay.
So we hope that we can do it, and we are trying to do much more better for cleaning, irrigation, activation, so we can reach everywhere. We can try to use the magnification for sure, microscope or loupes in order to check all the anatomy.
Right.
But at the end, anatomy is the most challenged issue that we can face in endodontics.
Yeah. And maybe from lecture, I see the first topic that you are saying is about the magnification.
Exactly.
Yeah. So how you see, or what kind of equipment you're using for magnification? You use loupes or microscopes?
I started to use loupes when I was in undergrad.
Yes.
But directly in postgrad program, I started to use the microscope since the first day.
Yes.
Until now, I am using microscope.
Okay.
We are improving our, let's say, visibility when we are using microscope. The microscope is also improved.
Okay.
With more, let's say, technology coming to the microscope.
Yes.
Even the microscopes are improving.
Okay.
So we need to improve ourselves. We need to go with more magnification, with better lenses, with better lights each time.
Yeah.
So microscope is the best tool for endodontist.
So are you maybe encouraging every endodontics using microscope or for every treatment?
I don't need to encourage anyone because it's a must.
I see it's a must. Okay.
It's a must. For endo, it's a must.
So you've been using microscope for like...
I started 2013.
2013.
Yes.
And keep using that for every patient, every case.
Every patient, every case, every treatment I do, without magnification, I can't see anything.
Okay.
I can't.
Good. I know today the big topic for you, for me as a salespeople, we're also selling your kit, and it's very, very, very popular.
Yeah.
Doctor really likes that. But also I see a lot of doctors, they are a little bit afraid, endodontics afraid to do the oral surgery. So how you think about this, This
is why we actually developed this kit with Woodpecker.
Okay.
Because we as endodontists, we are afraid always of doing the surgery alone without the surgeon.
Exactly.
We always call the surgeon to do the surgical part.
Yes.
And then we do the endo part or the part related to the root. And then the surgeon will continue the suturing and the other details of surgery. But we need to reach to, let's say, an area that we can do all the treatment steps, all the surgical steps, alone as endodontist.
Okay.
One of the most challenges that we are facing is the instruments and the machines, the devices that we are using for surgery. It's all related to surgical field.
Yeah.
So That's why this idea came to my mind, is to change and to reduce the amount of machines we have to use during surgery.
Okay.
And use one machine only,
Okay.
which is the piezo. I tried to check the tips of piezo. I tried to see if there is something compatible with us as endodontists in order to use and to cut the root, to do the osteotomy, to do all the steps of the surgery. Unfortunately, I couldn't find everything in one kit.
I see.
And it's very confusing to choose the tips.
Right.
And sometimes the tips are big because it's for surgery, not for endosurgery.
Yeah, not to speak, we have over 100 different tips for you to choose.
Exactly. So sometimes, maybe if you use big tip, you are more aggressive than the traditional or conventional pair.
Yeah.
So I came with Woodpecker with an idea to develop a kit specially for endodontists to perform all the procedure with the piezo.
Gotcha.
And then you know the whole story.
Yeah,
we
yeah.
developed and we changed many tips. We changed the design. We designed the new tips, new diameters, in order to be compatible with the microsurgery that we are doing.
Gotcha. So basically, for the apical surgery, you're using one single item. The piezo can fulfill all the procedure.
Yes, because with the piezo you can do the osteotomy.
Okay.
In order to do the osteotomy, we need electric motor, straight hand piece,
Yes.
round bears.
Yes.
So we cancel this. We use only the localizer tip, which is the round tip on the piezo. It cuts the bone very well.
Okay.
Very fast.
Okay.
Very efficient.
Yeah.
So for osteotomy, we can use the localizer tip.
Sure.
Then, after the localization of the apex, exposing the apex, we remove the bone.
Yes.
We need to access the root and cut the root.
Okay.
3 millimeters of the root.
Okay.
We used root cutter tip,
Gotcha.
R cutter.
Okay.
After that, we need to shave the root to
Right.
remove all the irregularities. We use shaver.
Right.
And sometimes, in order to go in and access the root, we need to do window,
Right.
which is the bony window technique. We use bone cutter tip.
Yeah.
Very sharp tip to
the saw tip.
to define the window.
Right.
And then we remove the window, finish all the procedure, then we place it back.
Okay.
So 4 main tips to deal with bone and root. And the other 4 tips we designed to deal with the retro prep and complete the steps with 3 millimeters prep, 6 millimeters prep, left and right for difficult anatomies in posterior area.
Okay.
So 8 tips that can do everything on one machine. So the idea is one kit, one device for all the procedure.
Okay. Yeah, and here's maybe a little bit advertisement time. So maybe later on we can have a link for you so that you can learn more about maybe the kit.
Yes.
And actually, this is the feedback for the tip is so good. I have so many doctors that are using that. Yeah. So talking about using the piezo for the apical surgery. So simplification, that's something that you mentioned.
Exactly.
You can use one device for everything.
Exactly.
So other than that, do you have any more advantage? Because some doctors
For sure.
Yeah.
For sure. It's not only about using one kit and one device.
Okay.
It's about using the advantages of the piezo machine itself.
Okay.
You know, with piezo, we have less trauma.
Right.
So less pain.
Yes.
We have less trauma. We have less post-operative pain.
Gotcha.
We have better control of bleeding
Yes.
because of the oxygenation,
Right.
because of the irrigation that is continuously happening during the surgery. We have more control,
Yes.
more precision,
Yes.
more, let's say, precision near the anatomical structure.
Yes.
The sinus, the nerve.
Yes.
You can control the cut. You can
Yes.
control everything, especially the visibility.
Right.
When you are using ultrasonic, which is piezo, at the end it's ultrasound.
Yeah.
So when we are using ultrasound, the cut is not, let's say, a cut that could not be reversed.
Right.
It's a cut
Yes.
that will not harm the area.
Yeah.
While with the bear, one cut can destroy the area if it is a wrong cut.
Right.
So with the piezo, it's a reversible.
Yes.
You cut, you see that it's not 100%, okay, so you stop.
Yeah.
The area is still not harmed.
Right.
So that's why piezo has more precision,
Yes.
more safety
Yes.
in near the anatomical structure, and more accuracy.
Right. So it is really like that. Cause say using piezo that you really can see what you are cut, because the view compared to the maybe electric handpiece or whatever.
100% different.
Yeah, 100% different. Okay.
And you have to know, we as endodontists, we like to use ultrasound.
Yes.
Why? Because we are expert in ultrasonics.
Right.
We use ultrasonics, handpieces, ultrasonic tips in a very narrow areas.
Right.
Like inside the root canal, inside the pulp chamber. So we are used to this.
Yeah.
So when we transfer this experience to the surgical field, which
Right.
is bigger and more wider,
Yes.
we will be very experienced
Right.
in using ultrasound in such big area. Because in very narrow area, we are using it perfectly, all endodontists.
Okay.
So what about bigger area, which is the surgical field?
Yeah, yeah.
It will be more easy for us.
Sure.
That's why we have to transfer our experience we are getting from ultrasonic during the study years and the postgrad programs. Then we need to implement this into surgery by using Piezo.
So
we will feel like it's something very easy and very normal for us. Otherwise, if you are using straight hand pieces, bears, surgical, let's say machines, it will be difficult.
Okay.
Because we are not used to such bears, such devices, such machines.
Okay. Yeah, maybe in case there's some maybe endodontics, they are really want to try the kit, really want to use them Piezo in the apical surgery. So what kind of tip you want to give to them, or like how long it really takes them to learning this kind of the technology?
Actually, we did many hands-on courses for endodontists.
Okay.
And I see that during the workshop, directly they master the technique.
I see.
Again, because the ultrasound, handpiece, tips are easy for them.
Right. They're using that every day.
They're using that every day. So when they just transfer the same knowledge to the window technique, let's say, or to the osteotomy, or to the root resection, it's the same.
Yeah.
So they are just doing it with the Piezo easier than doing it with other let's say, techniques or other machines.
Gotcha. So you think maybe this is not difficult to just to kind of the mindset.
It's easier.
It's easier.
Actually,
it's even easier.
Easier. For endodontist, easier to give him a Piezo to do the whole procedure, or give him a round bear, straight hand beads, electric motor, something he didn't use at all during his study program, let's say.
Okay. Yeah, maybe then the last question is how maybe is the feedback of the patient after using the Piezo? Are they
big difference?
Big difference.
Yes, because it's not my only experience. We have articles talking about the quality of life of patients.
Okay.
When they compared traditional way of doing the apical surgery with the Piezo way or with the Piezo-driven approach, they found that less pain, less post-operative pain. They found less swelling. And less trauma. During the surgery, less bleeding. So the quality of life of patients with the Piezo was better than with the traditional technique. Mainly, I suppose, because of less trauma.
I see. Yeah, I think that also fits your philosophy to give like better dental care for your patient.
Exactly.
Yeah. Maybe at last. So could you maybe say something to the audience, like especially for those of your big fans, to give them some tip about the course you're giving them?
To be honest, it's something like a real pleasure for me to always share my knowledge, always share my tips and tricks. I suggest for all my colleagues, friends, to keep learning, keep pushing, keep improving, keep developing themselves, keep learning new techniques, new procedures. For endosurgery, it's a procedure that they have to do at the end. They have to do because they will have failures. They have to fix the failures. They will have some cases that could not be retreated. They need to redo it or to treat such teeth, to save such teeth with endosurgery. So my suggestion is to learn the technique, master the technique, take courses first of all, see many and a lot of videos, and then start on, let's say, extracted models to master it, then start on patients. And at the beginning, if you want to start with a surgeon behind you, it's okay. Then you will do it alone, step by step.
I see. So keep learning, start the surgery.
Exactly.
Okay. Yeah, I think that's all for today's interview. Thanks a lot. Thank you.
Thank you, Stan. Thank you so much. Thank you, everyone.